Hi everyone, this is Shalli Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. So welcome back to my YouTube channel again. So if you like my videos, please press the like button now and subscribe to my channel. So I'm back with another NMC OSCE video for you, and this time we're going to look at how to dispense medication correctly for your NMC OSCE exam, because this is one of the most common fail in your implementation station, and because you can't show the examiner that you can dispense medication within the guidance which is correct for UK, okay, for the because there is a certain way we dispense medication in UK, and you need to show the examiner that you can dispense your medication safely for your patient. So we're going to look at that today, and I'm going to give you my top tips and some pointers how you can do this correctly in your exam. So let's talk about it. So you're at a stage where you know what medication you're going to give. So you have read your patient drug chart, you have worked out 2-3 drugs, whatever you're going to dispense for your medication, for your patient, correct medication for that. So you have decided already that what is the correct medication, what are you going to dispense. So how do we dispense it? So this is where we are at the moment. So let's look at that. The first thing is, as coming on your screen, we use aseptic non-touch technique in UK to dispense our medication. That means hand hygiene is important. Just before you dispense it, make sure your hands are clean. Second thing is, we are not allowed to touch our tablets, okay? So we cannot touch our medication in UK. It has to be non-touch technique. So it means you need to dispense straight from the bottle or the box. They use both. So they, for some medication, they will use like little bottles where you have to twist the top and open it, or then otherwise it would be just a cardboard box, little box. So it will be labeled with the medication name, the dose and the expiry in your exam. So you need to make sure it goes straight from the box or bottle into the medicine pot, okay? And you do not touch the tablets in between at all. They should not touch your hand in any way or form. So that's really, really important. So you take your box, you put the desired amount, whatever you need, straight into the pot. Number 2, medication checks. Now this is really important, because again, it would be very unsafe practice that if you're dispensing things and you're not checking the name of the drugs or the dose or the expiry date, because then how do you know that drug is safe to give it to your patient? Now the other thing is, you may be checking with eyes in your exam, but you're not verbalizing it. If you're not verbalizing it, your examiner will take that as not done. Okay, so it's really, really important that you verbalize the name of the drug. Say I'm dispensing paracetamol, I will pick up the paracetamol from my trolley. I will say this is paracetamol. I will say this is 500 milligram. Expiry date, I'm just making it up. For example, expiry date is March 2025, 6, whatever it is. So that's with an expiry date. Okay, so that's really, really, really important that you verbalize those details for every drug you dispense very, very clearly, not just like flashing your eyes on it and just thinking it's okay. No, you need to verbalize it very clearly to your examiner. So next thing is, now the right amount. So that's again is the drug administration principles: right dose, right amount. So how do we know? Right route we know is oral, but how do we say it's the right amount or right dose? Basically, we're giving to the patient. So you need to check what's the stock dose on your box, and then you need to compare it to the prescribed dose in your drug chart for the medication. So I will say, okay, this is my paracetamol 500 milligram. I've already checked the dose and expiry. Now I'm checking against my prescribed dose. My patient is prescribed 1 gram. It means I'm going to dispense 2 tablets. Okay, so that has to be again verbalized very clearly, simply and clearly. Okay, so that's important. Next thing, what's important is the one kind of drug in one pot. So if you say I dispensed my paracetamol, now I'm going to dispense my amoxicillin or whatever it is. So I cannot dispense amoxicillin to the same drug pot as paracetamol. So I have to take another pot and dispense my amoxicillin in there. So different kind of drug, different pot. Now if I'm dispensing 2 tablets of paracetamol, they can go in the same medicine pot, but I can't mix it with other kind of drug. Okay, so different type of drug, different medicine pot. because it's not safe to mix all the drugs. So that's what we need to do. The next thing coming up on your screen is, what if you dispense extra, which does happen quite a lot in your exam, because you are worried, you're nervous, bit of shaky hands, you want to dispense one tablet, but 2 or 3 go on into your medicine pot from your box or bottle. So what do you do in that case? Do you slip the extra ones back in the pot or the box? Will that be correct? No, that will definitely not be correct. Okay, we never, once the medicine is exposed to air, we do not put back in the box or bottle again. It cannot be used. Okay, so you need to discard it safely, and you need to discard it in the sharp bin. They give you sharp bin in the exam. So do you put your finger in it to take it out and put it into sharp bin extra bit? No, you can't, because we can't touch our tablets. We can't do that. So what we need to do is maybe take another medicine pot and slide the extra amount in there slowly, and then say I'm discarding in this into the sharp bin. Now they won't let you put it in there because they don't use actual medication, they only use like sweets. So they will, examiner will say just leave it next to the sharp bin and assume it's been discarded. Okay, so that is the correct technique. If you dispense extra amount, it cannot go back in the bottle or box, and you cannot put your finger in to take it out. So you just need to slowly slide it into another medicine pot. So I hope this makes sense about dispensing medication. Now lots of people ask me, should I dispense one, give one and sign one, or should I dispense all, give all and sign all? It's really up to you how you practice. As long as you use the correct technique and you do the correct documentation, whether you give one and sign for one, or whether you dispense all of them, give all of them, then sign for all of them, both are fine as long as the technique is correct. Okay, so I hope you like this video, and if you do, please press the like button now and subscribe to my channel. Also, you can visit us on OSCE and we give training for both pediatric OSCE and adult OSCE, both online and face-to-face. Or for a lot of nurses now, it's the combination of the two. You have some face-to-face days and some online days, depending on your work schedule. So we can work around, we will work, we have the flexibility to make sure that if people want to mix the two, then they are allowed to mix the two, because sometimes it's not easy to travel for all that many days. So you might be able to do some days from online and some days face-to-face. So that's all okay. But do email us if you have any inquiries on oscenustraining@outlook.com. So that's our email address, and check our Google reviews about what nurses been saying about our training. So I am going to be back with another video for you soon. So I will hopefully be doing another topic very soon. So bye for now.